Hello everyone, this is your pharmacist Sidra. In today's lesson, we're going to talk about high alert or high risk medications in pharmacy. What are some of the key points you need to know as pharmacy technician while handling these drugs to ensure patient safety? So stay around. Let's first define high risk drugs. A high alert or high risk medication, or HAM, is a medication that bear a heightened risk of causing significant patient harm when used in error. High alert drugs are not necessarily more prone to medication errors, but if mistake occurs, the consequences are clearly more devastating, life-threatening, and permanent to patients. Medications classified as HAMs have a narrow therapeutic index. Narrow therapeutic index drugs are medications for which there is a small difference between the minimum effective dose and the minimum toxic dose. In other words, these drugs have a narrow margin of safety, meaning that small changes in dose or blood concentration can lead to significant therapeutic failure or adverse effects. Pharmacists, like all other healthcare professionals, fear the same horrible scenario that a wrong drug is probably given to a patient, wrong dosage of the drug, or even the wrong patient gets the wrong drug altogether. We know that drug errors like these can lead to severe illness and even death. Just to give you an idea of how bad consequences could be, I want to share the most severe example of a pharmacy drug error where a pharmacist named Eric Kropp was charged with involuntary manslaughter in 2009 because a pharmacy tech working under his supervision prepared the wrong chemotherapy drug dose, resulting in the death of a 2-year-old child. And because of this, the pharmacist was sentenced to 6 months in prison and lost his license. How terrifying this is. And this is why it's very important to handle high alert drugs very carefully, double check your work, and if you are ever in doubt, do not assume. Always ask your supervising pharmacist you're working with. Institute for Safe Medication Practices, short for ISMP, is an organization devoted to preventing medication errors and providing medication safety information. ISMP provides a list of HAM drugs for specific pharmacy settings. According to them, there are 19 different categories of HAM drugs. I have a list on the screen. Each of these categories feature medications with specific and unique characteristics that separate them from other types. Let's talk about some of the more hazardous or commonly used high alert medications that you must know as a pharmacy technician. Anticoagulants are the medications that prevent or reduce the coagulation or clotting of blood. These are commonly referred to as blood thinners, even though they don't actually thin the blood and are taken by people with a high risk of developing a blood clot. Anticoagulants can be highly detrimental to patients if not used correctly or if proper precautions are not taken. For example, suppose someone using this medication were to sustain an injury that leads to bleeding. In that case, the wound will not stop bleeding because anticoagulants prevent blood platelets from coagulating, meaning clot the blood from constantly flowing. Now, this person could continue to bleed until either they receive professional medical treatment or the effects of the medication wore off, and excessive bleeding, mind you, can cause death. Now, some of the common anticoagulants are warfarin, heparin, and Pradaxa. Insulin is also high alert medication. It is used to lower blood glucose levels in people with diabetes. It comes as several different preparations, each of which has concentration and the duration of action. Some are long-acting like Lantus and Basaglar, which last up to 12 to 24 hours, while some are short-actings like Novolin, which lasts up to 8 hours. Some act quickly, but they last for only 4 hours, and they are called your rapid-acting insulins like Humalog. Now, mistakes with insulin occur more often than with any other drug. if a person is given the wrong dose or wrong kind or wrong amount of insulin, or even at the wrong time, their blood sugar level can drop dangerously low, and that could result in altered mental state, seizure, coma, or even death can occur. Next up in HAM list are opioids, also called narcotics. These medications reduce pain. They produce a feeling of euphoria, sedation, and are extremely habit forming, meaning they cause dependence and are therefore at the risk of abuse. Narcotics are recognized as high alert and are highly regulated and controlled because a slight overdose of these medications, be it medically or illegally, can result in respiratory failure and death can occur. Some of the common narcotics are Norco, Percocet, Dilaudid, hydromorphone, which is the generic for Dilaudid, and morphine. The next category of high alert medications I want to talk about is sedatives. Sedatives are central nervous system depressants designed to reduce a person's alertness and awareness. In normal doses, in addition to causing sedation, they cause impaired thinking, slurred speech, and unsteady gait. What makes sedatives extremely dangerous is how they function. They force the body into sedation, and the medication can then cause a respiratory depression, which is slowed breathing. It can also cause decreased heart rate, a lower blood pressure. And while these conditions are not really dangerous at moderate levels, but they can lead to death if they are too extreme. Sedatives are classified as HAMs because if they are administered at too high of a dose, a patient will enter coma or perhaps even die. Now, medication errors can occur with any medication and anywhere in the distribution system, including prescribing, dispensing, and administration. Common causes of such errors include poor communication, ambiguities in drug names, directions for use, medical abbreviation, or maybe prescription handwriting, or patient misuse because of poor understanding of directions from the pharmacist. Now, where your role as pharmacy technician comes up is because I think pharmacy technicians play a vital role in ensuring the safe handling and administration of high-risk drugs because you're at the back end kind of preparing the medication. Therefore, pay attention to details. Carefully review the drug orders, dosage instructions, patient information to prevent all of those dispensing errors. Always double check your procedures. Implement double checking protocols where applicable. In this method, what happens is the technician or pharmacist kind of double checks or verifies drug orders and preparations. That basically just adds an extra layer of safety when handling these HAM drugs. Also, it's important that high-risk drugs should be stored securely and handled with care to prevent any contamination or mix-ups. And just remember, as a pharmacy technician, you should always follow the established protocols for storing and dispensing these medications. Always ensure there is effective communication with pharmacists, healthcare providers, and patients to ensure accurate medication administration and address any concerns or questions. Also, you want to stay up to date on the latest safety protocols, any drug interactions, any best practices through ongoing training, professional development opportunities, or continuing education. In addition to these methods, you should keep in mind the 5 rights of medication administration to prevent any errors. The 5 rights of medication administration are the right medication for right patient at the right time, in the right dosage, and through the right route of administration or right method. The way I remember these 5 rights is by just a silly acronym or phrase that reminds me of the consequences of not following the 5 rights, and it's Mr. Porter to death route. I hope by adhering to these principles and collaborating closely with pharmacists and other healthcare professionals, you as a pharmacy technician can help mitigate the risks associated with high-risk drugs and safeguard patient well-being. Thank you for joining me in this lesson. Let me know in the comments what other topics I can bring you to help you become an amazing pharmacy technician. Until next time, take care. Bye.
Hey guys, if you found value in this video, give it a thumbs up, share it with your friends and family, and remember to subscribe to stay up to date on new weekly videos.